Hi everyone, this is Lisette Loera. I'm accompanied with Lisette Malagon and Janisha Simmons, and we are going to talk about stroke education.
What is a stroke? A stroke is a disease that affects the arteries leading to and within the brain. When blood vessels are blocked or ruptured, the brain cannot receive the needed oxygen and nutrients, which causes a stroke. If your brain does not receive oxygen, the brain cells die. There are three types of strokes. Ischemic stroke is when clots obstruct the blood flow to the brain. Hemorrhagic stroke is when the blood vessels rupture and preventing blood flow to the brain. And transient ischemic is aka mini stroke caused by a temporary blood clot. Who is affected by stroke? Your age, which increases with age. Family history, if your mom, dad, siblings, grandparents had a stroke, especially before the age of 65. Race, African Americans are affected more. Gender, women are affected more than men, and they die more from strokes than men. And if you've had a prior stroke, TIA, or heart attack, you're at much higher risk for having one. According to San Joaquin County Public Health Services, the top 5 causes of death, stroke is number 4 on the list.
How is a stroke diagnosed? The most important scan is going to be your computed tomography scan, and it should be done within 20 minutes of the person entering the hospital. This determines whether the person is having a hemorrhagic or ischemic stroke, which determines their treatment. The MRI, your transcranial Doppler flow studies, and transthoracic or transesophageal echocardiographies can show where the clot is at or what type of bleeding is happening, but the most important is your CT scan. Effects of stroke can be divided into left brain, right brain, where the blood clot or bleeding is at. So we're going to see paralysis on the right side of the body, speech and language problems, memory loss, and the patient will exhibit a slow, cautious behavior if it's occurring on the left side of the brain. So they're going to require frequent instructions and feedback, as well as having reduced ability to do math, reason, and analyze. If it's occurring in the right side of the brain, we're going to see paralysis on the left side of the body, vision problems, memory loss. They're going to have an impulsive behavior, such as trying to walk without help, and they're going to have issues with depth perception. This makes them at higher risk for falls, and they're going to have a lack of ability to recognize emotions in someone's voice. And any person can develop depression or anxiety from having a stroke. Prevention is controlling your modifiable risk factors, which includes reducing, stopping tobacco use, alcohol use, increasing physical activity, managing your blood pressure, your cholesterol, and blood sugar, maintaining a healthy weight, eating a healthy diet, and getting healthy sleep. To spot a stroke, we say be fast. B is for balance. You're going to see a sudden loss of balance with the person tilting to one side, having unsteady feet, becoming dizzy. E is for loss of vision or vision changes, such as blurry vision, is reported by the person. F is for face. You're going to see drooping of one side of the face. So you're going to have the person smile, one side goes up and the other side stays drooping. Arms is drifting to one side. You're going to have their arms go up, one drifts, one stays up. And S is for slurred or unable to speak. So remember that a side effect of stroke is the inability to speak. So during the stroke, they may exhibit slurred speech, and after the stroke, they may exhibit slurred speech or the inability to speak. And T is for time. You want to call 911 immediately because strokes are time sensitive. So a treatment of an ischemic stroke includes the carotid artery stenting. This removes the plaque in the carotid artery and can only really be done if the carotid artery disease is what's causing the stroke. Tissue plasminogen activator, known as TPA. This is the most important drug to give for ischemic stroke. It breaks up blood clots that block blood flow to the brain and has to be given within 3 hours after stroke symptoms start. So that's why it's such a time sensitive. And then thrombectomy removes clot from blood vessels via angioplasty, which uses a stent to open up a blood vessel. And then treatment of a hemorrhagic stroke includes aneurysm clipping to help stop bleeding from the aneurysm, blood transfusion to replace blood loss, coil embolization, surgery, and radiation. Surgery can be performed to temporarily remove part of the brain if there's too much swelling from the blood.
Stroke myths. A stroke Myth number one, a stroke is like a heart attack. The fact is that both share similar risk factors. A heart attack affects the heart, and a heart attack affects the heart, and a stroke affects the brain. And myth number two, a stroke is a brain bleed. The fact is that there are two types of stroke. Hemorrhagic strokes occurs when a blood vessel is ruptured or burst, resulting in bleeding in the surrounding tissue. And ischemic stroke happens when a blood clot blocks any vessel, cutting off blood supply, or therefore oxygen. And strokes randomly occur and can't be prevented. But the fact is that genetics factors can contribute to a stroke, and up to 80% of strokes are preventable by managing risk factors like not smoking, maintaining a healthy blood pressure, cholesterol levels, blood sugar levels, maintaining a healthy body weight, and exercising regularly. You can treat symptoms by taking aspirin, but actually the fact is that aspirin is only used to treat ischemic strokes. And with the hemorrhagic stroke, there would be other treatments. Therefore, the best option would be to call 911 immediately and have the experts or the physicians decide your treatment plan and when to take aspirin. For nursing management, nursing care is very significant to stroke patients. Often, two or more body systems are affected, and conscientious care and timely interventions prevent further complications. Providing holistic care, taking care of the patient's mind and body are essential. For improving mobility, we would position patients as their alignment may be disrupted, and include splints at night to prevent any joint flexion in their hands. We would also position patients to prevent deformities, add pillows to prevent adduction of the arms, and like I said, adding splints. We would change positions and remember that one side of the patient is affected, and therefore turning or repositioning every 2 hours or often if possible to prevent any further complications. And we would establish an exercise program, including range of motion, to improve mobility and muscle strength. And we would also start to prepare for ambulation. We would begin by sitting, standing, and then having our patients walk to prevent from any further complications like pneumonia or blood clots. We would treat the shoulder pain because one side of the shoulder is affected, and therefore they increasingly have pain from the weight of the arm or the deformities from the muscles. We would also enhance care by adding self-care to our patient using their unaffected arm, and have them use their unaffected arm to brush their hair, comb their hair, and also brush their teeth with the unaffected arm, like I said. There are several resources in San Joaquin County. You can go to your local San Joaquin General Hospital, and that's a stroke center, or also at Dignity Health, St. Joseph's. There's also a stroke support group that's offered every first Wednesday of the month.
Here are our references, and thank you.